Hi nurses, welcome to Shift Change, the podcast for nurse leaders who are ready to shift their thinking from just a nurse to claim their position as a powerful agent for change. I'm your host, Amy Deagle, founder and CEO of the International Network of Nurse Leaders. We believe in the power of nurses to change the world, so let's get started. Hi nurses, welcome back, or if it's your first time joining us, welcome. I am so glad you're here with us today. I'm Amy Deagle, host of the Shift Change podcast and founder of the International Network of Nurse Leaders. I'm really excited to welcome today's guest, Julie Robison. Julie and I were actually co-workers at my very first nursing job in a small rural hospital, and we reconnected professionally a few months ago when my staff took the training that Julie's team offers. And, reconnecting with a former colleague and hearing what she'd been up to over the last 13 or so years, I thought it would be great to bring her on the podcast and just share a bit about what she's been up to and the person-centered care that she really stands for. So as usual, we'll be putting the links to any resources that she mentions in the show notes. So if you're interested in learning more, you can visit nurseleaders.ca/podcast and just click on the episode with Julie Robison. So Julie's passion for nursing began early on in childhood when her family was able to provide palliative care for her grandfather at home on the family farm. The experience of watching her family advocate for her grandfather and provide care for him in his own home and on his own terms fueled Julie's desire to help others and ensure the patient's needs are at the center of how care is delivered. She went off to receive her Bachelor of Nursing from the University of Calgary in 2005. She spent the next decade of nursing in rural healthcare, working in a number of areas including emergency, obstetrics, public health, and chronic disease management. In 2012, Julie had an opportunity to become a trainer for health change Mythology within Alberta Health Services, which focuses on person-centered practices. The program fundamentally changed not only the way Julie practiced as a nurse, but also how she lives her life, including how she is raising her two rowdy red-headed children on her acreage in rural Alberta with her husband, Kevin. She is currently the Senior Advisor, Behavioural Change Methodologies within primary healthcare in Alberta Health Services, and is an accredited Health Change Associate. Julie empowers clinicians and healthcare teams across the province to approach their delivery of care in a way that puts the patient and family first. She is also a master trainer for the Better Choices, Better Health program and has extensive experience in supporting self-management initiatives across Alberta. She believes that nurses play a critical role in leading patient-centered care and that together, nurses can lead a paradigm shift in the way care is delivered. So I'm so excited for you to have a listen to my interview with Julie Robison. So welcome everybody to the next episode of the Shift Change podcast. I have Julie here with me today. Julie, welcome and thank you for joining me.
Thanks for having me, Amy. I'm really excited to be able to be here and have this opportunity to chat with you.
I'm thrilled that we've come kind of full circle here from our first, my nursing job with you, kind of as my first foray into nursing, into now chatting about what you've been up to for the last number of years. So can you walk us through your nursing career and your journey into what you're doing now, some of the highlights you've had over your nursing career?
Yeah, happy to. And I think I echo what you were just sharing about how things come really full circle. It's great to be able to connect with that nurses that we've worked with in the past and actually see what their journeys have been and share the stories. I think there's so much power in storytelling and for us to be sharing what our experience has been. So it's great to see the work that you're doing. So for myself, as you shared in my bio, I think for me, my nursing career really was launched from a personal experience with my family and having my grandfather go through a cancer journey and really seeing that need to put patients' needs at the center. And our family really had to come together and advocate for his needs to stay at home during his palliative care. And I think that's what made me really want to go into the profession of nursing because I knew I wanted to help people. And I knew that it was a place where we could really make a change in people's lives. And so after my after I took my nursing degree at U of C, I knew I needed to go back to where my heart was, which is rural. And I'm so thankful for the experience and the time I spent in rural nursing, because I think in that setting, it really helped me to dive into understanding how to work with people. Because I think as a rural nurse, one of the things that you really have to do, and maybe it's not just rural nursing, I think probably for any nurse, is that you have to understand all the team players' roles. So, I remember when I was working at that level of point of care, you had to be able to appreciate and understand the role of housekeeping, because at 3 a.m, you were the housekeeper, and you needed to be able to understand all of the administrative and clerical pieces, because that would be part of your work. But you also then needed to be able to be prepared to step into roles above you, like the physician role. And if they didn't show up, you may be the one that had to deliver that baby in the middle of the night. So I think rural nursing really was a great opportunity for me to build a lot of skill sets, but really appreciate the value of team and how you needed to not just understand them, but to embrace that and learn from other people of many different roles so that you could build your skill set. So that's I think will always be at the core of who I am as a rural nurse. And I had the opportunity over the years to also move into other areas like public health, which I think was a great experience for me to really come more from a wellness model and try to do some of that preventative work to really help keep our communities and our families healthy. And that's where I fell in love with my role in coaching and teaching, and had the opportunity to become an educator for our patients, and loved that role. Really enjoyed, working with patients and their families to help educate them on health and wellness, and help move into that space where they could start to self-manage and really take control of their own health and acquire those skills. And it was during that experience of working in the space of education that I had the opportunity to move out of the clinical world and move more into a provincial role that looked more at systems changes and helping support operations, and have a focus in where my area of passion now is, in self-management and person-centered care. So I think I've, had quite a range of different experiences, and been really thankful in each of them to learn from my team and, take those lessons and help me be the leader that I am today.
That's great. And, with the training that you did through the Health Change Mythologies, that's how we reconnected a few months ago. And really that course we had a chat about it, is really changing the way that nurses look at delivering care. And really, we thought that should be being addressed while they're even in school.
Yeah, I really believe that. I think that, one of the questions that you sent forward to me was really looking at, understanding maybe some of that shift in our system. And I think for me as a nurse, one of the things that I experienced when I was trained is that, I learned a lot about the theories and the models, and understood about the task space and the assessment pieces that we needed to do as nurses. But an area I really didn't feel overly equipped with was understanding how to, work with the patients and families in front of me to understand what was going on in their life. So I think every nurse and every healthcare professional, for that matter, really shows up with a person-centered perspective. We come into these roles because we want to help people, and we care, and we are empathetic, and generally have a number of really good communication skills. But there's more to it than that, right? It's more than just the art of that. It's actually knowing how to work with that individual, understand what their needs are in the context of their entire life, that allow us to really get to the root of what's going on for them and truly help them, whether that's at point of care, whether that's providing an education class, or now when you're non-clinical, if that's in a meeting or you're in a boardroom with a group of stakeholders and you're trying to elicit large system change. So I think, it's not something that I personally had in my schooling, but I'm also hopeful because I'm starting to see some shifts in how in academia were training nurses and how they're coming out now as graduates. So I think that there's some movement towards that, but I think, there's still work to be done.
Yes, as always with everything in nursing.
Yes, isn't that true?
Yeah. So I've heard from a lot of nurses that they didn't realize that, leadership or even, that education role was really a career path within nursing. Can you tell us a bit about how nurses, really at any stage of their career, can get involved in leadership and look at expanding outside of that point of care role if they're interested in that?
Mm-hmm. Yeah, I really believe, Amy, that every nurse is a leader. Brene Brown is one of the thought leaders that I really enjoy. And in one of her recent books, Dare to Lead, she defines a leader as anyone who takes responsibility for finding the potential in people and processes, and who has the courage to develop that potential. And I believe that, every nurse in every position has that opportunity. And it's really about then, embracing that potential and following whatever that passion is that you have as an individual. So what drives you? And, if that's in a point of care setting, there are many opportunities. I think back to my days on the floor, and there were many opportunities where we could step up as leaders, whether that was within the team or if we had a change happening at our local site. I remember at one point in my career, there was where we lost some of our support staff who had been doing some of the prep for our OR patients. And so we really needed to step up as a leader and define some new processes and have the team drive. What are we going to do different now that we didn't have that role, but we still needed to ensure our patients had the care they needed and were prepped for surgery? And we had to come up with a local solution and really work together to drive that and even create some resources around that. So I think at any point, at any stage, we have the opportunity to be leaders, and we have to be, courageous to step into that and speak our truth and understand, what drives you and where you might want to put that energy. So I think that happens, across the board, whether that's point of care or I think it's, at any point in the journey.
Yeah, I so agree. And, we are so uniquely positioned to help influence and empower people just by the virtue of being a nurse. And really, once we understand the power that holds, I think we're going to see a lot of shifts in nurses really claiming that leadership perspective. So you mentioned Brene Brown as one of the thought leaders that you follow. Her book, Dare to Lead, is one of my favorites as well. I actually have that quote posted up on a wall. Are there any other resources that support you on your leadership journey? Books, podcasts, courses, conferences, anything like that you'd like to share with the audience right now?
Yeah, I think there's a lot. I mentioned Brene Brown, but I also think something that's been a huge impact, especially for me in the last couple of years, is actually Twitter. And so I'm not somebody who would consider myself, really well versed in social media. And I had one of actually my mentors encourage me to get on Twitter and really use that venue to help inform my perspective and to help share, my thoughts and experiences. And one of the thought leaders on there that has been instrumental for me, especially in the areas of quality and improvement, is Helen Bevan. So she's the Chief Transformation Officer at the NHS. And I think it's a space that's emerging for us in healthcare to really be able to learn, to share, to create networks, and to really build a tribe of people who have thoughts much like yourself, but also to see those opposing views so that you can have a better understanding as a leader about what are some of the issues that are out there. And so for myself, that's been a huge resource. I think I know for a fact I've read more articles and been introduced to more people through that resource than I have in any other way in my nursing career. Mm-hmm. And then, then there's some great things like, depending on what your leadership style is, whether that's servant leadership, I've read some great books on tribal leadership. And then, some of the go-to podcasts like the Harvard Business Review, all of those things I think are really great resources. But also, again, I think it's coming from, where does your desire and passion come from? And for me, a big piece of that has been in understanding human behavior and communication. So some of my go-to references are things like The Language of Caring, that really focuses on some communication principles. And then, accessing my own local resources within my organization. So there's been a lot of pieces to help me discover who I am as a leader. So insights discovery and different leadership programs, and the NHS does offer a virtual school called School for Change Agents. And I think we just have a multitude of different resources available to us. And I would just say, search that out, follow what you're looking for, and lean into it and find that.
I agree. And I love that you mentioned, learning more about yourself so that you can lead others. I think that's a key piece that new leaders, new managers sometimes overlook, is the importance of really knowing yourself and where those strengths and weaknesses lie and how to use them for the best of your ability. And we did a 5-day challenge with the International Network of Nurse Leaders that's focused all around really diving in and learning about yourself. So if anybody's interested in that piece, they can go to nurseleaders.ca, and it's just available as a free opt-in on the homepage. And any of the resources that Julie just mentioned, we will also link in the show notes, so people can get in touch with those resources. And also we'll get your Twitter handle and stuff up there as well, Julie, so they can connect with you on Twitter.
Absolutely. And I think, what you just mentioned there, Amy, and I love what you're doing with the Network Challenge, because I think, that's been fundamental for me, is really taking the time and space to understand who I am and how I show up. And I think one of the most, impactful ways I've gone about that is actually recording myself. And so this is something that, we really advocate for in the work that we do with the program I lead. But when you actually have the opportunity to listen to yourself, so whether that's in a conversation in a boardroom, or if it's in a meeting, or even in fact, there's ways that we can do this when we're working with our patients and families, to actually understand how well am I doing as I work with them. Am I actually working in a way that's person-centered? Am I engaging in the way that I want? It's really changed the way that I operate as a nurse and as a leader. So I think that that's a really untapped way of learning about yourself, is to record and listen back and do some self-reflection, but also then to get feedback from multiple people. So I think one of the most important things that we can do as leaders is to be checking in and hearing from those that we're working with, our teams and our patients, about how things are going. And to just have that space and that ability to create the open, honest relationships that allow you to hear from them about what does that look like and what could I do better, and always coming from that point of understanding of, what can I do better, but also, what am I needing to learn in this situation, and what might I do different as I move forward. And I think for me, that was taught really early on by some of my great nurse mentors, even in the sense of when we were doing if you had a medication error and how you actually dealt with that. I think there's so much about our ability to be transparent and to learn from situations that I think is critical as a leader.
I agree. And also, just on that point of recording yourself, nothing more humbling than listening to yourself post podcast interview. You learn a lot, and how many times you say and sentences that you think are making sense and actually do not. So it definitely is an area for self-reflection and growth, that recording yourself and listening back. Also, I found in meetings, I didn't realize the horrible faces I make. That's just my face. So I'm sitting now, I'm trying to sit where I can catch my reflection, because sometimes my thinking face also looks like disgust. And, it's not that at all. It's just the face I make. And so I'm really trying to make sure I have self-reflected, and that I'm critical in watching myself on, making some of those involuntary gestures that maybe are coming across horrifically in a meeting. So yeah, journey of self-discovery in leadership.
Well, yeah, and love that point that you just brought up, because I think when, we think about the nonverbal communication that we have, and sometimes we don't even recognize what we're doing, and then how that may impact how somebody takes in our communication and how that maybe changes, decision making or how that relationship is working. So I think all of those pieces of understanding and the reflection from, recording yourself to what your nonverbals are, to getting the feedback, those are all things that can really help you develop and help you be, a stronger leader that really is, showing up in the way that, is your best self.
Yes. And it's humbling, as we mentioned. So what do you think is the biggest challenge facing nurses today? I know there's a lot of them, but if you could pick one to talk about, what would you want to address?
Yeah, that's a good question. I think, that's a hard one because I think there's so many things that for us as nurses and the nursing profession is faced with. But, I think it's which things are changing around us. So, whether that's looking at our profession changing, so there's so many great movements, but in those changes, change can be hard. And so we're having to learn to adapt as, we move to things like being able to prescribe and working to full scopes of practices. But also, things changing in regards to our government and politics and how policies are developed and how the healthcare system itself is shifting. And of course, in other areas, then how the patients and families that we're working with, how they're obtaining information and showing up and being better equipped, which is great, to be advocates for their care. And we're wanting that, but us as nurses need to be able to be engaged in those processes and have the skills then to do things like shared decision making and ensure that the way in which we're working with our patients and families is coming from a place of understanding their needs. And so I think, that constant change, things around us, ever evolving is probably one of the biggest challenges because it really pushes us as individuals and as a profession, to stay up to date, to stay current, and to constantly be learning. So to be improving our practice, to, finding new sources of information and to find networks of people that can really help you to grow and gain that information so you can stay current amongst the change and feel really confident to work as that change is happening around you.
Agreed. And, we've heard people talk about that patient or person-centered care, and it kind of seems to be a buzzword in healthcare. Can you tell me what person-centered care really means to you?
Yeah, I think that's, one of those things that we have is, a challenge for me because, I think everybody, whenever we go anywhere with our work and we ask if, nurses or healthcare providers are person-centered, everybody, of course, says yes. And I think every nurse believes that they are, and they show up trying to work in that. But I think for me and the work that I do, person-centered, is really about understanding who that individual is in front of you. So it's being able to understand what matters to them in their life and understanding the context of their life. And so that requires a very different skill set than just being empathetic or being a good listener or, being kind and caring. It actually requires us to have a skill set to put the needs of the patients first. But when I say that, that means that we still have a duty of care as nurses where we have accountabilities and we, we're working with them for a reason. We're trained in this profession. And so what we need to be able to do is actually have a collaborative shared approach in working with them so that we can help them work through their health journey. Because at the end of the day, it's our patients and our families that have to do the work, whether that's, them taking their medication or attending a referral appointment or, making lifestyle habits or, dealing with the multiple complexities of their conditions. They're the ones that are actually needing to do that. So our role really has to become about how do we understand that context of their life and how do we work from that point and really help them in that. So, it's a lot more than just, that kind of fluffy stuff that people often call the soft skills of, being good listeners. I think often nurses are put into that place of saying, they're really good at that. But I challenge that because I think it's, there's a lot more that we need to gain as nurses in order to do that work really well. And I'm really fortunate to see it happening across the province here in Alberta, and seeing a number of teams really take this on and make, tremendous shifts in the care of patients and their families.
And you've really focused the last few years of your nursing career in behavioral change and self-management. So what was it about those areas that was a draw for you as a nurse?
Yeah, I think for me, one of the draws was, seeing how, understanding the human experience, I think, is what was really my draw, is recognizing that, each of us as individuals really have processes that we go through to make a change, and being able to understand that not just fascinated me, but helped me to understand why in certain situations I was able to either help my patients and their families make change, or, maybe that was my colleagues if we were trying to implement a change on the unit or within a program. Once I was able to better understand the needs of us as humans, I was able to start to work through those processes with people and have intention to the way that I worked. And so for me, I think that, that was the draw as a nurse, was to discover this area that was new to me, and to really begin to, understand the evidence and the science behind it. And then the outcome of that was I was seeing my patients and families make more change. I was seeing them be happy and, getting the outcomes that they were looking for. And for me, that's the greatest reward as a nurse, I think, is when we're able to actually empower people to be living the life that they're needing and wanting to. And so that's what I experienced as I started to work in these areas of self-management and behavior change. And it's just been a continual drive for me, because I think as people understand it and work differently in their practice, they start to see those changes happening. And that's incredibly rewarding on multiple levels.
And that's really how we create that ripple effect of change and positive changes that we need to see in the world today. So thank you for that work that you're doing. We're just going to take a quick pause here because I wanted to mention that the International Network of Nurse Leaders membership community is now open. We are accepting members from around the world, nurses who are looking to get inspiration, encouragement, and really get momentum with getting their ideas out into the world, or nurses that love to be champions of these ideas and just want to be connected around their nursing peers who are working to change the world. So if you're interested in having that kind of community, head on over to nurseleaders.ca/membership. Can you just explain a little bit about the Health Change Mythologies program and what that really is? Because when, my colleague and I were looking for some education to put our staff through, and we came across this, and some of our staff had done it a few years prior and had mentioned, how beneficial it was. And so we brought the whole team together to do that training. And I think a lot of people maybe aren't aware of it yet. And correct me if I'm wrong, but it was an Australian-based methodology. Is that right?
Yeah, the methodology itself was created and founded in Australia by the founder, Jeanette Gale, who's been a fantastic mentor for me in this work, and really has been a great support for me in my career. But the methodology itself, it's a behavior change methodology, and what it does is it brings together the behavior change literature and provides an approach to the way that you can deliver care. So I often think about, the idea of, again, kind of what I was speaking to about in academia. We learn about the tasks and the skill sets and the evidence and the physiology as nurses, but we don't necessarily have something that gives us that same type of structure or approach to the way that then we work with somebody. And that's what this methodology does. It actually brings that together so it can guide us and how do we communicate with someone so that we understand what their needs are, and how do we explore, what's getting in their way and what their barriers are, so that if I know that, then I'll be able to work with that and actually be more likely to help them to make the changes that we're looking for. So it's really a methodology in that it's encompassing an entire approach to care.
And I really love the theory behind, meet people where they're at, whether that's a patient that you're dealing with within a point of care role, or as a nurse manager dealing with a staff member, really that meet them where they're at philosophy. Can you expand on that?
Yeah, and that's another one of, I think, the terms that's used quite a bit, right? Like we hear, when I ask people, are you person-centered in your care? And everyone says, yeah. And then you say, well, how do you know that? And they will often respond by saying, well, I meet my patients and families where they're at. And my thought is always like, well, what the heck does that really mean, right? Mm-hmm. Like, what is meeting somebody where they're at? And I think that that's what this methodology does. It actually defines those processes. So I can actually, when I'm in a conversation with somebody or I'm providing care to somebody, I can actually, from an evidence perspective and through the processes, understand where somebody is at so that I know what I need to do next or what I need to build up for them and how I might empower them within it. So if they're in a place where, they maybe have inaccurate expectations of what they need to do, I know that that's where I need to work from and help build that health literacy for them. So, it helps define how you could do that as a nurse. And it's all based on, of course, the evidence, right? It's around the grounded evidence in behavior change and in human-centered behavior.
Mm-hmm. So, Julie, I think the work you're doing is amazing. And as a leader in the nursing profession, what change do you hope to impact? And I know you're nowhere near the end of your career, but if you could think about, being years and years down the road, what would you like your legacy to be and the change that you impacted for the nursing profession?
Yeah, I think, I feel like I'm barely starting on the surface of it, having been a nurse for 15 years. So I know I have much more to go through in my career. And I think one of the things I've learned is you'll never know where you'll end up, right? So I think back, Amy, when you and I worked back together in the hospital, if someone would have told me this is where I'd be today, I would have never believed them. Mm-hmm. So I think one of the things you have to be open to is to be open to all possibilities and learn how to lean in and step in to different roles and to, be courageously afraid, right? So if you're afraid, go into that and be brave and explore those opportunities. And I think that's what, has helped me to get where I am currently. So I think, in that, I think it's hard to know maybe at this point what I want my legacy to be, but I do know that the one thing I'm passionate about at this point in time in my career is to help, build across, not just for nurses, I think across healthcare teams, an ability to put our patients and families at the center of everything we're doing. And so I know that sounds a bit cliche and it's something that, I think most people would say, but the work that we're doing is really helping bring a patient voice to the work we're doing. So in many of the projects and initiatives that I'm leading, we're partnering with patients. So they're beside us in the development of resources and helping do the system transformation and not just, it's not just us in policy, it's, having their voice there. And I think one of my legacies or hopes is that my grandchildren will experience a very different healthcare system than what we currently have today, where they will be really empowered to be the ones leading their health and that the providers that they're working with know how to work in that space, but they actually are working in a system that supports them to, put the patient's needs first, to put the context of the community within how they're operating at the foundation of all the work. So that's what I guess I hope to achieve. I really hope that we can get to that place where that becomes the norm and that's the way that the system operates.
I love that vision, and I think you're well on your way there. And I love the point you make about, you maybe don't know exactly what your legacy is going to be because the first 15 years of your career has shifted and evolved so much. And that's the piece I love about nursing as well, is that you can have such varied experiences and tap into so many different parts that still is considered nursing. I mean, even for my own career, I started as a point of care nurse in rural hospitals, did labor and delivery, was a certified nurse midwife, a travel nurse, to primary care and then into management. And that's been in a, 14-year time span. So who knows where our careers will take us. But I just am truly appreciative of the work that you are doing, Julie, to impact our profession. So thank you for that.
Well, and I think that that's the exciting thing about nursing. I think about, you ask some questions about what I'm hopeful for or what I'm seeing as positive things in nursing. And I think the breadth at which is available to us is truly outstanding, right? As nurses, the opportunities are endless for us, I think that, we have the ability to work in so many different areas and influence so much change that I think that is why it's such a great profession to be a part of.
I agree. And, sometimes it's, I talk to people and they're feeling frustrated and burned out with where they're at in their nursing career and they're thinking of leaving the profession. And I just urge anybody that is feeling in that space to reach out, connect with a mentor. You can reach out to myself. There's so many different avenues within nursing. Don't leave the profession yet. Let's work together to find a better fit, because it really is finding that fit within nursing that brings out your strengths and really will encourage you to kind of get reinvigorated with passion for nursing again. So if you're feeling frustrated and burned out in nursing, reach out, because there are so many different avenues that you can explore. So on that kind of note, Julie, what changes do you think need to be made in order to attract more people into our profession and retain the nurses that we currently have?
Yeah, well, I think, one of the things that you were just highlighting is that for us to value and put more energy into things like mentorship. Mm-hmm. I truly believe that I wouldn't be where I am today without great mentors. And in many ways, having sometimes to seek those out, to really find people that had opposing views in me that would help me grow and expand my own thinking, but then also having, a really strong tribe of people that can be positive supports around you and that you can bring challenging situations to, or when you've had a really, crappy shift and, you've gone through some really awful experiences. Because I think as nurses, especially when you're working in point of care situations, you are often that one that's dealing with, a loved one dying or a traumatic event. And we have to be able to have ways to connect with one another and tell those stories and share those experiences in order to process them and to, keep our own mental health really well. So I think mentorship is an incredibly important piece that we need to spend some energy on as nurses. And I think individually to seek those out, find those networks, find those resources, and really look for that and keep that a part of your daily practice. I think one of the things that, has been foundational for me personally is leading from the point of gratitude. So I think, as nurses, we're often, bombarded with lots of, changes, as I was speaking about, but also we encounter some really tough moments. And so it can be hard at the end of the day, to feel like, you want to stay in the job, or that you really are enjoying what you're doing. And so for me, doing things like keeping a gratitude journal every day and really, finding the joy in my day has been really important for me as my own personal practice as a leader, to keep myself grounded in the good that's there, and help me in those kind of tough moments. So I think that that's a really important piece. I think another thing in retaining nurses is, for us to continue as a collective to work together and find, again, those areas of passions to come together and as collective voices really work on the things that drive us and support one another. So kind of getting rid of that mindset of, you're kind of doing it just for yourself, but come together as whole collective groups to really move change and shift it.
I love that. And I love that you mentioned the gratitude journal. That is also a daily practice of mine that completely changed my life. And just even Melanie Beattie had a 40-day gratitude challenge. She has a book out, and it was about writing down the stuff that, you maybe it seems weird that you would be grateful for. So the tough parts in your life, the stuff that is hard or heavy, really finding the gratitude in that and finding the lesson and the learning and being able to grow from that. So it's not just kind of the fluffy, I'm grateful for a cup of coffee, but really, I'm grateful for this colleague who makes me, crazy sometimes, but is showing me, my limits on patience or that sort of thing. So really finding that lesson within those kind of hard and sticky parts of your life as well really helps with that gratitude and appreciation.
Oh, absolutely agree with that. I think that there's, endless possibility for us to, to dig into those hard things that we're experiencing in our own lives and find the good in it. And that can actually really shift, how you lead, how you show up, and the way you just go about your everyday life. So definitely appreciate that, Amy.
Yeah. So Nursing Now's 2020 mandate is to help raise the profile and status of nurses. Even though we consistently rank as one of the most trusted professions, we're not necessarily the most influential profession in healthcare, especially when it comes to policy and decision making. So what do you think are some things that we can do every day to help achieve that mandate and really increase our influence in terms of policy and decision making at, not only government levels, but just at local and community levels as well?
Yeah, I think that each one of us has to own our part in it. So, I think, as nurses, we need to lean in. So we need to kind of shift from more, this is my day-to-day work, whatever that may look like, whether that's point of care or, if you're working in a provincial role or, national role. I think all of us, regardless of your where you're at in your nursing journey, you need to own our part and be confident to share your wisdom and expertise. So, we have a wealth of experience based on what we do every day and what our journeys have been. And so we need to be better equipped, I think, to share those stories, talk it out, let people know what it looks like for you. And that's why I love what you're doing with this podcast, Amy, and the work that you're doing is you're creating really a venue for people to come together and collectively, create that tribe and share across systems. And I think that really is what we need to be doing if we're going to achieve that mandate. But one of the reasons I think that is that from the work that I do, I think nurses are really valued. I think that our other colleagues in different healthcare professions value our perspective and recognize the hard work that nurses do every day and that they have a really unique perspective. We're often the ones that are spending the most time with patients and have, such an in-depth knowledge of how the system works. And we need nurses to be at the tables that are informing that kind of system change because they're the ones who actually probably have the most of that available to them. And so I think, that's what, I would encourage and I hope to see is that each one of us can lean in and find what our part is in it and be the voice for the changes that matter to you.
I love that. And that segues perfectly because the vision statement of the International Network of Nurse Leaders is that we believe in the power of nurses to change the world. So what do you think of that statement? And in your opinion, are there some issues or platforms that nurses can put our collective voice behind to really make a difference in our world?
Oh, for sure. I love that too. I believe that. I definitely believe that nurses have the power to change the world. And I think when it comes to issues or platforms, I think to me, the most important piece that you can do is what they call relational activism, right? So finding something that does matter to you, something that is important to you and who you are as an individual and get behind it. And so for me personally, there's, areas that I really think us as nurses can influence, such as loneliness. I think this is a real issue right now that we're experiencing, and the evidence has really started to show that loneliness is a greater risk factor, in fact, than for disease and dying and even smoking. And so for me, this is one of the areas that, I'm really passionate about right now is to be looking at how we can collectively within our community start to combat loneliness and help ensure that, something like that is addressed and that we're actually getting to something that's really an emerging issue within our communities and, across the province. So there, I think that's one thing, but I also think, really it can be anything. I think nurses have so much to offer in areas of politics, in regards to system transformation. I think, another big area that I'm passionate about is really around mental health and how we're supporting, especially youth, during this time when we're going through the opioid crisis. I think that there's a lot that we can be doing as nurses to help offer ideas and solutions and to help be the change to make some differences in our communities.
I love that. And I haven't heard anybody bring up loneliness as one of those platforms, but you're so right. That is an area that nurses can make a huge impact. And in fact, I challenge anybody listening today to start today. Even smiling at a stranger, you don't know the difference that can make. And you're right, nurses are perfectly suited to kind of lead the change on that piece. So thank you for that one. That is incredible.
I love how you bring forward something simple that we can start with today, because I think that's another piece of leadership. I think is just, it doesn't have to be huge and monumental. We can really just look at what's one small thing I can start with today that can change the way that I interact, or the way that I communicate, or the way that I, support my patients and families. And so, things like giving a smile, or making a phone call, or holding someone's hand, or, asking what matters to you. All of those things are so incredibly significant in somebody's day and have the ability to elicit change. So, I love that concept of, start with something.
Yeah, and I think that was one of the biggest things with learning when I started management in an official capacity, is there's so many things you want to impact change on, and it can seem overwhelming, and you kind of get stuck in that paralysis because there's so much change to be making. And it's really looking at what can I do that's something small today, but done repeated over time is actually going to make a difference. And that, I truly believe, is the steps to success, are those tiny little changes that you can make, and if you do them consistently, that's what's going to influence and impact change in our work environments, in our personal life, and just not getting discouraged, because that tiny measure may not seem like much today or tomorrow, but a year from now you'll see a completely different life if you commit to that.
Oh, yeah, absolutely agree with that, Amy. I think one of the mentors that I've had recently in my life, who's worked in a number of different management roles, that's really her sentiment, is that, often when she comes into a new role, and recently she's moved into a new role as a manager, that, you feel like there's so much, right? And trying to decipher, where do I start, and how do I help my team in their functioning, and how do I reach out, and what do I need to do? So being able to step back from that and look at some of the smallest things, kind of what I call getting back to the basics, right? Mm-hmm. So the basics of communication and the human factor of what we do as nurses, I think will always help you. And if you value those and you put those as a priority in all the things that you do, I think it can really, help shift the way that you work with people.
I agree. And, one of the things to change team culture is as simple as you eat lunch together now. Right? You take out that professional piece, and it's about people connecting on a personal level. Food brings people together. And just by implementing a simple change like that, of syncing everybody's lunch hour to the same time so that they come to a communal spot, that's changed team culture drastically. And it's crazy that some of those things that we overlook as being very small and insignificant are actually what makes the changes. So just, you kind of touched on it already today, Julie, but is there anything else that you wanted to address on things that you see happening today that make you proud to be a nurse and proud of where our profession is heading?
Yeah, I think, there's a number of things, like I was alluding to, that make me proud to be a nurse. I think, seeing our expanded scope is great, but and seeing, nurses work in a number of different areas and influence change, as we've been talking about. And I think that what's hopeful in that is I think we're starting to build a stronger culture across the nursing profession for people to be courageous, to have the supports behind them, to, feel more confident, to speak their truth, to tell their stories, and to be those leaders of change. And I think that that's, really what makes me most proud, is that we're starting to, make some headway with that, and things like these networks are helping us to do that as a united force. And that's, I think, really, what is making me most proud right now.
That's awesome. So if you're listening to this and you're thinking, oh, there's some changes I would like to be making, or you feel inspired by the guests that we've had on the podcast, and you're looking for a way to connect with mentors, or you are a mentor and you're looking for a way to connect with younger nurses who need that mentorship and support, you can go to nurseleaders.ca/membership to find out about joining our network. So Julie, is there anything else that we haven't touched on today that you would like the audience to know about, or any parting words of advice?
Yeah, I don't know. I don't know if there's anything else that I have to add. I just really encourage each of us. We're each uniquely qualified in our own way to lead and impact change. And so, I would encourage all nurses, dig deep and discover for yourself what your why is and what really matters to you individually. And then follow that relentlessly, and always show up from a place of curiosity. And when you show up with curiosity and that desire to learn, that's what courage will look like. And you'll be able to do great things, and opportunities will open up for you, and new spaces that will really allow you to be, the leader that you're meant to be within your own world.
I love that. Thank you. And, thank you for the work you're doing and the changes that you're helping to create within our nursing profession. I think the work you're doing is admirable. And thank you for taking the time to be here with us today.
Oh, well, thank you, Amy. I really appreciate the opportunity to chat, and love what you're doing. I think it's definitely needed, and look forward to staying in touch with all the work that you're doing. So thank you again.
Thank you so much for joining us today. If you loved the advice shared on this episode, we would be so grateful if you would let us know. Please head over to Apple Podcasts, formerly known as iTunes, and subscribe to our show, and then rate us and leave your review. We would be so grateful if you would take the time to subscribe, rate, and review. While you're on our website, nurseleaders.ca/connect, all of our social media handles are there, and we would love to get to know you on social media as well. Thank you again for listening today, and remember, nurses, we have the power to change the world. Let's start today.